And on this note, I would like to start my presentation, which is Periodontitis and Diabetes mellitus, a knowledge and perception study among the Indian diabetologists. Firstly, I would like to thank Dr. Dominica for beautifully explaining the concept about the diabetes and periodontitis and explaining its bidirectional relationship, which has been proven epidemiologically, biologically, and therapeutically. And what could be the possible mechanisms? So the possible mechanisms for the bidirectional relationships could be the shared mechanisms like immune dysfunctions, inflammation, neutrophilic activity, and cytokine biology, which makes them bidirectional to each other. Now, diabetes causing periodontitis, or the effects of diabetes on periodontitis or on the periodontium, has been well proven, has been seen in many journals, many articles, and many people are aware of it. So their proportion is high. But the association of periodontitis on the glycemic levels or on diabetes are well documented, but it is less known among the diabetologists and other medical healthcare professionals. So the value is a little less. So therefore, the oral health is often neglected in diabetes care, and there is limited physician and dentist collaboration which we need to work upon. So therefore, an article had been published in the year 2022 by RSSDI, which was conducted by the DIOH chair and co-chair, Dr. Sangeeta and Dr. Sumita Bansal, respectively, which I will be presenting right now. So the study design of this article was a cross-sectional study survey in which there were 210 participants, endocrinologists, and it had 34 questions which were divided into 3 parts. First, awareness about periodontal disease and its relation to diabetes, demographic and oral health, and practice setting. The data was assimilated and the results were extracted out of it. So firstly, the analysis of the demographic data. It was seen that the maximum respondents were within the age group of 41 to 50 years, and the least in the age group were 30 years, which was 1%. 28.6 respondents followed the correct frequency of brushing. 44.8 used interdental and supplemental aids, showing good level of awareness, and 61% practiced tongue brushing. Second results, analysis of oral health awareness amongst the participants. So there was a good level of oral health awareness among all the endocrinologists and diabetologists. 56.2% were informed about their oral hygiene, and 69 knew that prophylaxis was required every 6 to 12 months. Then third results were the analysis of the practice, in which 72.9 respondents were aware of a dental facility in the vicinity, but the periodontal referral was only 11%. Whereas 70.5% of the respondents were aware of the fact that the dental specialization dealing with treatment of gingival diseases are done by a periodontist. 74.8% of the specialists had a hospital-based practice, and majority were the clinicians of about 57.6%. Then fourth, analysis of awareness about periodontology as a specialty. So 85.2% of the specialists agreed that the oral health is necessary for overall health, and 64% were aware about the periodontal disease and its symptoms. 49.5% strongly agreed that inflammation is the key component, and 48% responded in affirmation on the effect of periodontal treatment. Dose-dependent relationship between severity of periodontitis and complication of diabetes. For example, the end-stage renal disease was not quite well known. That was about 28% of the participants. Fifthly, the analysis of the dental care recommendations, in which it was seen that there was a significant relation to the type of practice and age group and the years of practice. So that means as the experience of the endocrinologist increases, the awareness about this association was also increasing, and also on the type of practice. So if it was a hospital-based practice, so the referrals were seen more in a hospital-based practice. And the question on collaborative training of medical and dental students, which is a very valid and important point, received a significant response with respect to participants of years of practice, like 11 to 20 years of experience. Sixth result was the analysis of participants' awareness or periodontal health. So it was seen that the effect of inflammation, periodontal inflammation, and diabetes and its role in increasing diabetic complication had a significant response in relation to age and experience. Also, effective control of periodontitis in diabetes management was also significantly associated with the age and experience of the participant. Participants were also aware of the symptoms of the disease, increased risk of periodontitis, and their bidirectional relationship. Lastly, the results were the analysis of participants' personal dental health awareness. So all the participants, all the diabetologists were quite aware about the importance of periodontal health, and they used to have a proper brushing technique, a proper brushing regime. So coming on to the discussions, so many consensus guidelines and CAP studies were incorporated, and we had come to a discussion that in the year 2012, the European Federation of Periodontology and American Academy of Periodontology on periodontitis and systemic diseases concluded that proper guidelines should be drafted for periodontal care in diabetes for both professionals and for the participants. And the European Federation of Periodontology and IGF in 2017 updated this consensus, and they came onto the conclusion that they had included three kinds of dual sets of the guidelines. One for the patients having diabetes, second for the oral health professionals, and third for the medical professionals. And they also emphasized on the role of medical professional in knowing about the awareness, having the awareness about the periodontal effects of diabetes on the periodontal health. Also, they emphasized the oral professionals to diagnose the undiagnosed diabetes and pre-diabetes depending upon the oral conditions and the HbA1 status of the particular patient at that point of time. A Turkish study was again done in which there was a positive relationship seen between periodontal health and systemic health. And a UNC study revealed 50% of the subjects did not know or disagreed the treatment of periodontal disease might improve the glycemic levels. But in our study, this is our study highlighted the knowledge of a bidirectional link, not only the effect of diabetes on periodontium, but also the effect of the periodontal health on the glycemic levels. So it is the first Indian study undertaken exclusively among the super specialists. Other studies also included the medical professionals, interns, and other doctors. 80% of the respondents strongly agreed that the collaborative training for medical and dental students is of prime importance for taking up this subject further. And referral rate in our study was 11%, which is similar to the study from the Hong Kong study. Other studies also had these results in which dentists were significantly more aware than the medical health professionals. Gingival bleeding was the most common sign which was seen by the oral health professionals as well as diabetes in diabetologists when they were seeing any or diagnosing any patient. And general practitioners, oral health care practices among diabetic patients has also been seen in a limited level. A recent study demonstrated a predictive model that could be used as a reliable screening tool for periodontists in the primary medical care setting to facilitate referral of patients at risk for oral examination. So all these data came to a conclusion that diabetologists have the knowledge about the bidirectional relationship, but this did not get significantly translated into the referral rate. So there is basically a lacuna between the knowledge and transforming it into a practical science. So interdisciplinary collaborative approaches is required amongst both the practitioners, the oral health and the diabetologist to take this thing even further for the benefit of the patient. So there are future guidelines, for example, formulation of clinical practice guidelines, cross-training and interprofessional education. Policy should be made in India to emphasize the need for public health strategies to integrate oral health. There should be more scientific interactions, development of public awareness modules, incorporation of dental health screening in all the diabetic patients, Basic oral health information and patient counseling and education tools should be a part of the diabetic practice. Cross-referral should be there among the diabetologists and periodontists, and glucometers should be a regular part of the diagnostic armamentarium. So on this note, I would like to thank you all and thank you so much for the patient listening. Thank you.